Hello, my name is Caleb Smith with the Rocket Miner newspaper, here to provide your COVID-19 update for April 28th, 2020. One of the biggest stories in the Cowboy State today is that the governor, Mark Gordon, further outlined his plans to reopen the state. In modifying some of his state health orders, in some cases, our businesses will be reopening that have been previously closed, such as gyms, barbershops, hair salons, and other personal care services. Some other provisions are going to go on a little bit longer than previously announced. The intent is to move slowly, track how progress is going, make adjustments, continue to keep an eye on it, make more changes if necessary, as we try to, as safely as possible, and as carefully considered as we can, keep going in this time of pandemic. Quoting the governor, "These new orders start our process of getting this part of Wyoming's economy up and running again. We have asked Wyoming citizens to make sacrifices over the past 5 weeks, and they have responded. I want to thank these businesses for playing such an important role in our initial battle with COVID-19. Easing the restrictions on these businesses at this time is prudent and gets us one step closer to a return to normal." The guidelines generally note that there will be a process for county health officers to submit requests for county-wide variances if public health conditions warrant the change. The idea is to give flexibility and a little bit of deference to those on the ground, and we all know that it's even in a unique place like Wyoming. What's going on next door might be a lot different than what's going on here or going down further down the road. Breaking down the 3 health orders into a little bit more detail. Under Modified Health Order Number 1, gyms will be permitted to open on May 1st, as long as they adhere to public health guidelines. These include limits on the number of patrons in the facility, a requirement that staff wear face coverings, and the closure of locker rooms. When the gyms reopen on May 1st, at least for the foreseeable future, gyms will be prohibited from offering one-on-one personal training and group classes. The same order will also allow child care centers and home daycares to reopen or continue to operate under similar specific conditions, such as limiting the people to fewer than 10 in a room and implementing screening and cleaning protocols. Under another health order, this one number 3, we're jumping around. Businesses that may open on May 1st include nail and hair salons, barbershops, cosmetology, electrology, and aesthetic services. You can tell I don't use those a lot, but it's good to see them reopening. Massage therapy services, and tattoo, body art, and piercing shops. These additional conditions include limiting the number of patients, screening patrons and staff for symptoms of illness and exposure to a person with COVID-19, and requiring patrons and staff to wear face coverings and eliminating waiting areas. Just to remind you, running down the list of symptoms that's presently posted on the Wyoming Department of Health website. Symptoms which may appear 2 to 14 days after virus exposure include fever, cough, shortness of breath or difficulty breathing, chills, muscle pain, headache, sore throat, and new loss of taste or smell. In addition, Public Health Order Number 2, which limits public gatherings to 10 people or fewer, that has been extended through May 15th. The governor's directive requiring any individuals coming to Wyoming to self-quarantine for at least 14 days. We're going to find out what happens with that. Previously, the idea is that if you were a Colorado resident and you were coming to Wyoming, they wanted you to self-quarantine for that long. The governor's office has said that the extension is currently under review with a decision expected by tomorrow. So keep your ears open on that. In addition, the state is issuing a guidance to hospitals allowing them to resume elective surgeries. Looking at the breakdown of the numbers, I have like I said, I've got the Wyoming Department of Health site pulled up right now. We have 396 laboratory confirmed cases of the coronavirus in Wyoming, 140 probable cases, and 7 COVID-19 related deaths. Pulling out a little bit farther, turning to figures from the Centers for Disease Control and Prevention. In the United States, we have 281,246 total cases. The site itself has added a new figure to play with that I'm going to share with you. It says that there are 23,371 new cases compared to yesterday's data. When it comes to total deaths in America, that number sits at 55,258 people, which the CDC notes is 1,336 new deaths compared to yesterday. Turning to the COVID-19 dashboard maintained by Johns Hopkins University of Medicine. Worldwide, the total number of cases is 3,111,730. When it comes to the death count, that number sits at 216,857. And when it comes to the total number of recovered cases, that's currently at 925,442. One other story I want to just briefly touch on today. This is on my list of things I've mentioned before. Sometimes we have a tight newspaper and I can't get every story that I want in the newspaper. Or I certainly know other people who they work on hard stuff and sometimes you got to wait for the following edition, or just keep your eye on the online. We have way more stuff there than we do anywhere else. But I wanted to look at a story that talked about sleep research, particularly looking at dreams. And the fact that a lot of people are reporting COVID-19 related nightmares, or certainly uncomfortable dreams. It's noted that there's rarely been a worldwide event that also arose at a time with the level of communication we have, so that whether you're having night terrors in Pakistan, whether you're bedded down in Sweetwater County, whether you're in the Philippines or Egypt or Guam or wherever, that you can have a dream that shocks you to your core and you can immediately reach for, in most cases, your phone right by the bed, or your notebook, your laptop, and get it out there and share it so quickly. Well, there have been previous research that comes to that's been conducted when it comes to dreams of combat veterans or even 9/11. They're saying that there has rarely been such a, quote, collective dreaming that's going on right now. And I find it fascinating that even when we're separated, that we're all having this shared moment. And I'd encourage you that if you're one of those ones having the dreams that are just sends that shiver down your spine, that's troubling you, to talk to others about it. In general, we're already being told that not to suffer alone, stressing that our assistant hotlines are still open. Our emergency rooms and healthcare centers are still with common sense procedures in place, but they don't want people who feel like they have a stroke coming on to sit at home and suffer in silence. The same thing, if you're having these dreams that are haunting you, you have the opportunity to reach out and talk to other people about it right now. It may not cause them to go away. Certainly not until we get quite a bit deeper into this and our weapons against the virus, to whether it's a vaccine that halts it, whether it's more effective treatment that keeps it from progressing it to worse stages. Testing it helps us find it quicker to stop its spread. This is going to linger. But conversing with other people, recognizing that you're not the only one going through this, I think has the opportunity to blunt the power of some of these nightmares, or certainly not let it make us feel so isolated. You never know, you might even have a crazy dream that by sharing it with other people, it will bring a smile to their face on a hard day too. The Associated Press story ends with a person who had picked up a lot of library books before this Ohio stay-at-home order kicked through, and she's been running low on her supply, and she had a dream where her dresser was piled with books. Even something simple like that. A dream of stories yet unread. Brought her a little bit of happiness, a little bit of bittersweetness, and a little bit of expectation about the good stuff that's to come. And we should be looking for that here, whether it's going to be the latest Cruise in the Strip events, whether it's the upcoming graduation editions. Please be looking for ways to honor and recognize local kids, both through the school district, through social media. The Rocket Miner has some options too, as do other publications in our neighborhood. Just be looking for ways to connect, to share, to where we can focus on the positive, not to ignore the bad stuff, but not to give it too much power over us either. This has been Caleb Smith with the Rocket Miner newspaper, wishing you a good day and a safe tomorrow.